Hi, everyone. I'm Melissa Hall, creator of the free private practice paperwork crash course. And today I am here to answer your questions all about documentation. So sorry, we're getting started a little late today, but that's all right. We are going to talk about something that I've been getting a lot of questions about recently, which is collaborative documentation, or some people call it concurrent documentation, which is doing your notes with your clients. And there are a bunch of different ways to do that, and that's what we're going to talk about today. But before I jump in, I want to make sure that you have clicked subscribe below so you don't miss out on any future lives. And I might just be answering your question next. So you want to make sure that you know when those are coming out. Okay, so, and if you have any questions, feel free to put them in the chat box. So first of all, what is collaborative documentation? So this can actually look a few different ways. Some people don't realize that there are a bunch of different ways you can do it. The most common thing that most of us have heard about is actually writing notes with clients, and that is one option. So you can be in the session, you do the entire session, and then you spend the last 5 minutes or so writing your note with your client. And you can make that transition really easy by just saying something like, okay, we're going to spend the last 5 minutes wrapping up, and I just want to talk about or you can say, let's just talk about what you think was the most important thing we discussed today. Or you can say something like, let's just write a little summary of what we think we reviewed today. There are a bunch of different ways you can do it depending on, your own model and how you work and everything. So you can personalize that and make it fit in with that a little bit. So that's sort of the most common one that we hear about, and that is definitely an option. Another thing you can do is actually just do part of the note with your client. So if that feels a little intimidating to actually sit down and spend 5 or 10 minutes at the end of the session writing the note with your client, then just do part of it. So maybe you say, let's just jot down a couple of points. You could do bullet points with your client of what were the salient things or the things that really stuck out to them as important for the session. You could just to complete one sentence or one section of your note. So maybe you have a narrative portion of your note and you just help you and the client write that together. You could also have check boxes and you could have the client, check off kind of like a little summary of how they felt things went, topics they felt were really important, and then you could maybe write a little narrative afterwards. So there are a few different ways you could do that together. And sometimes it's a little bit easier for people simply based on, providing feedback later. It doesn't mean that you have to sit down and write together. So maybe like in your office, or maybe you do field-based work, and that's just, it's not really feasible or it's not as easy to do that. So this was actually the option that I chose to do in my private practice. So all of my clients had access to all their notes, and we used them sort of like a communication tool. So they could log they could log into their electronic health record account at any time and read any of their notes. So I took little notes to myself on a notebook, like just a regular notepad. If there was something I wanted to highlight, like a resource that I was sharing with them that I wanted to remember to add in the note. And that way they didn't have to worry about doing that. And I would just add that to my note later, and we both knew it was there and we both knew where to go to access it. That also means that if the clients had any questions or if they wanted to review things, they could go in there. And it kind of prompted them to get in the habit of going in there and actually looking at the notes as well as me. Now, the last option, and this is one I do recommend for everyone, and this is a little bit different. So it's not just about your daily or regular session notes, but your intake paperwork. So I do recommend, even if you are not a huge fan of writing notes with the client, for regular weekly sessions, that you do at least do some form of collaborative documentation for your intake paperwork. So during intake, there's a lot of paperwork to fill out and they're signing things, but you also have some type of an intake assessment or like a biopsychosocial form, right? I use those phrases interchangeably. And if you can have the client actually complete that, then it's really helpful for you to have them actually complete the forms first. And then you can go through and kind of add things later or simply note to add anything else that needs to be in there. It also helps with accuracy because you'd be surprised how often clinicians will forget and do things like, write that someone had 4 siblings when they had 3 or vice versa. So when the client's doing it, you're less likely to have those type of issues pop up. So now we're going to talk about what are some of the benefits and, potentially what could maybe be like a drawback of collaborative documentation. So obviously one of the big benefits is that it saves you time, right? So especially in that intake example, I know so many therapists who spend all this time doing an intake assessment, and you're spending a lot of time talking to the client. They're spending a lot of time filling out paperwork, and then the therapist goes and rewrites all of it. And that is one of my number one rules. I say try not to write anything more than once. So it's a huge, huge time saver for you. But it can also be really, really helpful clinically. So like it gives you a lot of time to reflect and focus on what happened. It also gives your client time to do that in a way that's a little bit different. So a lot of times, people kind of come in, they swoop in, they do their session, and then they leave. There's trouble finishing your sessions on time. I know a lot of therapists do. I hear that problem a lot. Another thing is, like I kind of talked about this with the collaborative documentation for intake, it really helps you make sure you're on the same page. So this way, at the end of a session, if you are writing a note together about what happened, you actually get a really great sense of what your client found valuable out of that session. And often it will be different. Something may really stick out to them that's different than what stuck out to you. And having that conversation in that way helps to make sure that you both understand what you think is important. And it can be really, really helpful if you have more than one person in the session to make sure that everyone is on the same page about what's going to happen next. And lastly, this seems a little counterintuitive, but according to a few research studies, this is actually a great strategy to engage clients, and especially to engage clients who are not already super engaged in therapy. So you would think most therapists don't like doing notes, so they kind of feel like, oh, like that's the last thing I would want to do, and it would make therapy more, like a horrible experience. But actually, it tends to do really, really well when clients don't, like, they're not excited about the therapy process. My theory, and this is not based on the research, this is just my theory, is that it's because you're giving the clients a voice, and you're giving them a reason to get in there and get engaged, and it's a way to get feedback from them. And typically, if people are in therapy but not super engaged in it, they're usually clients who are like adolescents, or maybe like a member of a couple who like the other person dragged them in. That makes sense. If it's like an individual who's on their own, they're just not going to go if they don't want to be there. So I think it's a way to help give your clients a voice. And then the last point I will make is that according to the research, it actually is really relieving for your clients to read their notes, which again feels like, why would they even care? Why would they want to read that? But when clients were asked about this strategy, they often said that they secretly feared that their therapist thought they were crazy. And when they were able to read the notes, this was in particular people who used the strategy sort of like I did, where maybe they didn't write them together, but the clients had access to read them all the time. That those clients felt like, oh, okay, my therapist doesn't think I'm crazy. Like they're actually reading and, think I'm a normal person, and we're on the same page about that. So, I think that's helpful to hear, because a lot of us, Valerie says it's a great idea. Awesome. I'm glad it's worth trying. It is scary. I know. Trust, I understand it's scary. I will say, if you want to try this out and it sounds like a good idea, but it's a little bit freaky, you can decide, maybe just do it with new clients coming in. So, keep everyone that you're working with the same. Or you can try like maybe every Monday and Wednesday, all those clients, I'll try it with them, and do it as a trial period. So you don't have to, it doesn't have to be permanent. It doesn't work for every client, so know that up front, but do give it a shot. Typically it takes 6 to 8 weeks to determine if it's really a good fit for someone or not. So commit to at least 6 weeks if you're going to try it out, see how it works, and then at the end you can reevaluate. Let's see, we have another question here. Can I address how I handle credit card fees at intake in the intake documentation, and whether it's legit to pass on to the client or insurance company? Payment by check has no fees. Great questions from Rock Your Relationship Premarital. I like that name. So totally different from collaborative documentation, which I think we're good on, switching gears there. My understanding is that it's actually more a legal issue than an ethical issue, passing on credit card fees to clients. So you don't want to do that. My take is that just as a business owner, that is part of business. So it also looks like it looks a little cheap sometimes if people try to do things like that. So what I recommend is just price it in. If your fee is currently $140 an hour, charge $145 an hour, understanding that part of your fee is things like your rent, maybe your electronic health record, and credit card fees. It's a service that you're able to offer people. It's definitely a huge help. I know a lot of clients don't like having to write a check. I know I didn't. So it's a huge benefit to your business. One option, if you are kind of like annoyed with having to deal with payment stuff, is you can check out Ivy Pay. So just go to type into Google Ivy Pay for therapists, and it's a great payment option that I've heard from therapists and from clients. They both really love. It's just an app. So it's like an app on your phone, and you text them a link. After that, they enter their credit card information using their own phone. So you never have to actually take the credit card info. You never know what their credit card number is. But once you have it entered in the app, then you're able to charge it every week. So it's a real, yes, Ivy as in the plant. So IVY and then pay, Ivy Pay. So it's a great option. It was actually started by a group of mental health advocates, and they also have some licensed therapists on their staff now, who were people that were trying to make therapy more accessible to others in the Bay Area, the San Francisco Bay Area. So one of the issues that they found kept coming up for clients was that they hated having to write checks all the time, and they wanted to be able to use their credit cards easily. And they found that some therapists weren't, it wasn't easy for them to process credit cards. So they created this app, and it's awesome. So definitely check it out. All right. Well, thank you so much for your questions. I don't think we have any other questions, so we'll head on out here, but I will be right back here next week, 12 p.m. Pacific time, every Monday to answer your questions. So if you do have a question that maybe you're watching the replay, you want me to answer, feel free to go to qaprep.com/contact, and we'll put the link below. And you can submit your questions, and make sure you're subscribed so that you don't miss the next week. I will see you all then. Bye.